Good afternoon. Today is September 16, 2022. It is a Friday, but it's a Bariatric Friday. My name is Kemal Erkan. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you for asking. And as usual, I am looking forward to another Bariatric Friday.
Thank you. As we had 2 weeks break in between. We have 3 patients in this 18 to 19 week period, and we want to make sure that we are able to put this in a different perspective from the patient standpoint. So we are utilizing some of actual patient data without the names. So we have 3 patients with this new process, and so we are going to actually discuss the topic around their life and then how this is affecting them. So let's actually, because Dr. we have a couple of weeks already, if you don't mind just giving us the background on bariatric surgery, so that way it will be a refresher for our people.
Absolutely, absolutely. So in our sessions, as Kemal said, we have 3 patients who are undergoing the process right now: Karen, Denise, and Patrick. And we've discussed previously what led them to bariatric surgery. Essentially, they are suffering from an illness known as morbid obesity. Yes, from our point of view, morbid obesity is an illness. It is an illness that is associated with many medical problems, and bariatric surgery or weight loss surgery is really the most effective treatment that we have available right now. I have been involved in bariatric surgery now for over 20 years. With my colleagues at CHRIAS, we've actually introduced a new way of doing bariatric surgery in our area, and we've established centers of excellence in bariatric surgery in several health centers in our area. So as a group, CHRIAS actually has by far the longest experience practicing bariatric surgery in our area. We've operated on thousands of patients successfully, offering all the different types of bariatric surgeries that are available in the United States currently.
Thank you, Dr. Erkan. So today's topic is smoking and alcohol. So these 2 topics, it does impact everyone's lives. So one of my main point every time we discuss these issues, this is never an issue for patients with morbid obesity, but this is affecting all of us. So, but it does affect some population a little bit differently and a little bit more severely. So, and because it has a huge impact on our preparation for our patients, we do want to make sure that our patients understand why certain things need to happen. Now, Dr. Irgau, we can actually start with smoking first, just so that, because it does have, especially prior to the surgery, smoking is one of the issues that may prevent the patient getting surgery if we don't actually address it in a timely manner. One of our patients is going through bypass, as you remember, and the other 2 are gastric sleeve. So, and this impacts them in a different way. If you can actually explain this from the overall standpoint, why it is bad, but also how this is going to impact these patients if they were smokers.
Absolutely, Kemal. This issue of smoking and alcohol consumption is very, very important for us as a bariatric program. It is one of the more common questions that we encounter among patients. Will I be able to drink any alcohol after bariatric surgery? And then, of course, one of the requirements that we have, absolute requirements we have, is for people to stop smoking before bariatric surgery. So that's a question that comes up as well. So I'm not going to be eligible for bariatric surgery if I don't stop smoking, right? But also the issue of alcohol and smoking has profound implications when it comes to bariatric surgery. So I'm actually very pleased that we are revisiting this issue. Kemal, we have discussed this previously, but it's an important topic, and I'm happy we are addressing it again. As you mentioned, in the patients that we are following right now, Karen is the one undergoing gastric bypass. Both Denise and Patrick will be undergoing gastric sleeve. So there are differences in terms of the impact of alcohol or smoking when it comes to this procedure. And of course, we will look this in detail. So let's start with smoking first. Of course, smoking is bad, regardless, right? Whether you're having surgery or not. Now, we've established conclusively that smoking is bad for your health. There is no question about that. People who smoke are more likely to have many, many illnesses, and really by far are more likely to die early compared to people who have never smoked. So that is an issue that we can put at rest. Then looking specifically at bariatric surgery, what are the problems? Well, the problems are that if a person is a smoker, Kemal, they are likely to have way more complications during their surgery and then after recovery, after surgery as well. And this also has been studied and demonstrated. Well, the risks could be serious. Some of them could be life-threatening. So that's why we are so focused on this issue of really abstinence, stopping smoking completely before bariatric surgery.
So I'm so sorry if
no, go ahead.
Because we want to make sure that our patients understand this, and because as you know, I communicate with them throughout our case conferences and understanding what questions we are getting. In simple words, I just need you to explain to me, like other than, yes, I know smoking causes cancer, but like I'm getting a stomach surgery, right? So why am I not able to smoke? How is that harming me for that preparation or for the surgery? I'm still not clear.
Absolutely. So clearly, a person who is a smoker will have damaged lungs, very weak lungs, right? Mm-hmm. And during their surgery, the person's breathing will actually be taken over by a machine because they will be intubated. They will be under general anesthesia, right? Weaker lungs, damaged lungs are actually much less likely to recover after this process. So a person who has damaged lungs, who has been continuously smoking, will have a much higher chance of not recovering well after their surgery from a breathing point of view. So they could be short of breath. They are at much higher risk of developing pneumonia and similar infections. So their recovery will be really delayed considerably, but also they could develop subsequent complications as well that will make their surgical experience really a major health issue, right? There are other consequences as well. Healing is affected by smoking. One of the things that smoking does to us, Kemal, is it decreases blood flow to different parts of our body. One of the cornerstones of healing after any type of injury or surgery is good blood flow. So if your blood flow is not optimal, Kemal, then your ability to heal is going to be affected as well. Because ultimately, as surgeons, yes, we know how to suture. Yes, we know how to put things together, but we rely on nature to do the healing as well, right? If nature is unable to do those, the healing will not happen. And if the healing has to happen well in some very critical area, like two portions of the stomach, two sides of the stomach, or the stomach attached to the intestine, then that can fall apart. And then substances that are supposed to stay included within the stomach or the intestine will leak out into the rest of the peritoneal cavity and cause sepsis, a very serious problem. So all these problems are directly related to the fact that the person may be smoking. That's why, because we want bariatric surgery to be safe, we focus on this issue. And because prevention is by far better than acting after the problem has occurred, stopping smoking is such an important issue for us.
So, and again, I'm asking this from our, let's see if I'm Patrick today. Mm-hmm. Okay. So age 30, BMI 50. So we require minimum 6 months, right, prior to surgery. Somehow, like 4 months before, I had a smoking incident. So that's going to stop my process or reset my process by 6 months?
It will not. It will not. Of course, we are, we have to use our common sense as well, right? It is important to understand that you're either a smoker or you're not, Kemal. I mean, that is something very important to understand, right? So when we talk about quitting completely, we expect our patients to honor that, to really understand the risks that they're putting on themselves, right?
Mhm.
Now, having said that, if Patrick comes to you and confesses, hey, look, I've quitted smoking, but I was with my buddies and they offered me a cigarette and I just completely forgot and I smoked it. Will that stop the process? Of course not, right? It's a one occasion thing. And it is unlikely to have as much of an impact as ongoing smoking, right?
Mhm.
But the problem, of course, Kemal, is that when people are trying very hard to quit, right? One cigarette can get them back very, very quickly into becoming smokers again, right? Anybody that has dealt with people who struggle with smoking will testify that. Now, as we have said in the past, we are not really minimizing the obstacles that our patients have when they are trying to stop smoking. Trying to stop smoking is one of the hardest things anybody can do, specifically because nicotine is such an addictive substance, right? So we're not minimizing efforts, but what we're saying is that it is important to understand that if you're working to improve your health and undergo a procedure that has potential risks, you want to do everything you can so that surgery is going to go as safely and as smoothly as possible. And stopping smoking will just do that. Now, going again about the issue of the person who's just had the one cigarette, the danger again is that if people go back to even doing one puff, Kemal, it is very easy for them to fall back again into the habit, no matter how hard it was for them to stop smoking the first time. So we want them to be on their guard, and we want to let them know that we have a zero tolerance policy. Really, if we know that you are continuing to smoke, we will not do your surgery, because our first rule is to do no harm. And taking somebody who is a smoker through bariatric surgery, we know will defeat the purpose of what we're trying to do, which is to make them healthy.
True. So now, up to the time of the surgery, it's one thing for smoking, but after surgery, it is any different than for anyone else who would be a smoker, or is it if our patient would be at more risk after the surgery if they smoke?
There will be, Kemal. They will be at risk because, up to now we've been talking about the dangers of smoking when it comes to going through surgery and recovering from surgery safely, right? But after the surgery, there are important implications, very, very bad implications to resuming smoking again, right? For both the types of surgeries that we do. And right now we're obviously focused on the two more common procedures that we undertake. One is the gastric bypass, and the other one is the gastric sleeve or sleeve gastrectomy. And as we've explained in the past, with gastric bypass, not only we're cutting the stomach, but we're rerouting the intestine as well and create a new connection between the stomach and intestine. That's gastric bypass, and that's the procedure that Karen is getting ready to have, right? And the gastric sleeve, on the other hand, we do not interfere with the intestine. All we do is we divide the stomach, and actually we remove over 75% of the stomach, leaving a person with a much smaller stomach at the end. Okay, so that's the main difference between these two procedures. And yet smoking can have very harmful effect after both procedures. Yes, clearly the harmful effects are much, much more with gastric bypass, but they are there with gastric sleeve as well. But let's focus on gastric bypass, which is really the far more important from this point of view. If a person continues to smoke after gastric bypass, they are likely to cause damage to the connection between the intestine and the stomach that the surgeon has made to construct their gastric bypass. That damage can lead to formation of something called ulcers. And ulcers are just like raw wounds that will happen right at that connection. And those wounds will not heal if the person continues to smoke. Those wounds not only are dangerous, but they're very painful, right? If a person tries to eat and they have an ulcer, they will have a lot of pain. It's really, really uncomfortable, right? So their quality of life will be miserable with the ulcers. But no matter how much medication we throw at them, as long as they continue to smoke, that ulcer will not heal. And there will be long-term consequences of having an ulcer. One of them is that the connection between the stomach and the intestine that has now an ulcer develop so much scar tissue that it becomes very, very tight, so tight that nothing can go through it. At this stage, patients may not be able to eat. They may not be able even to drink, and they will be throwing up constantly. At this stage, no medication may solve the problem, and surgery may be required. This is repeat surgery that they will have to be putting themselves through because of those ulcers.
Sure. I guess the healing impact is why it would be more on this one because of the
low blood flow. Absolutely.
Yeah.
Absolutely. Absolutely.
It does make more sense.
Yes, but there are other dangers of the ulcers as well, Kemal. And as we've explained in the past, an ulcer, as I said, is like a raw wound, right? Well, that raw wound continues to become deeper and deeper, and then eventually erodes through the whole tissue and bursts, causing perforation and causing something called sepsis, which is a life-threatening condition, and the person will have to be operated emergently, otherwise they could die because of that. Another consequence of an ulcer is that that ulcer could lead to erosion of a blood vessel and lead to massive bleeding that may not be controlled very easily, and massive bleeding is a life-threatening condition. So all that is related to the fact that if a person who has had gastric bypass continues to smoke, they will be putting themselves in this serious danger. And most bariatric surgeons will know that if they know that a person is unlikely to stay off smoking, even after bariatric surgery, they will be very, very unlikely to offer gastric bypass.
So, I mean, we talk about how dangerous this is and how painful and all that, and I get it. But what's the best way to quit?
So that's the major question, right, Kemal? We are talking here as if it's easy to quit, right? It's not. And also, once a person is a smoker, they're going to be a smoker all their life in terms of their mindset, right? So which means it is very easy for them to fall back into it, right? Of course, when you talk to patients, there are real-time pressures that push them into that situation. And that is the time where we have to obviously be prepared to lend a hand as well. Now, we have a lot of resources in our program, but also in healthcare as a whole to help people quit smoking. One of the great things we have in our setup, for instance, Kemal, is we can put a smoking cessation order when we know and identify that a patient is a smoker in our network, and that will initiate a series of measures that will be set up by the nurses, by the care coordinators, that will help provide resources for patients to quit smoking. So when we talk to patients about quitting smoking, we're not talking to them in a punitive fashion. We're talking to them as a resource for them so that we can help them quit smoking as well. Now, we have to explain the dangers. Of course, this is important. We have to tell it as it is, but at the same time, we have to provide a lending hand so that the resources are there for them to quit smoking.
So the exercise, the deep breathing exercise or yoga, meditating, so those also would be...
Absolutely, absolutely. But luckily, there are also pharmacological methods for people to help them quitting. Of course, the best way to quit is to be part of a program, and many primary care setups have that, where you are supported, including with the measures that you've mentioned, but also with potentially weaning programs, but also medications that really can be very helpful in helping
so
people.
we are talking about the nicotine patches and the inhalers, right?
Yes, absolutely, absolutely, absolutely. It is important at this stage, Kemal, before we go to the alcohol issue, that we talk that even a patient who has had a gastric sleeve is at risk of having complications if they resume smoking as well. Because remember, even though we're not reconnecting the intestine, Kemal, we have made the stomach a lot smaller. By making the stomach a lot smaller and removing the larger portion of the stomach, we've also removed a great portion of the blood supply to the stomach. So the blood supply to the stomach after the gastric sleeve is not going to be as plentiful as it was in the original stomach. So already with that diminished blood supply, if we add smoking, the blood supply will be decreased. So they will be at risk for ulcers and scar tissues as well. Now, we're specifically...
make the point. Normally, I don't do PowerPoints anymore, but like I don't know if you're
I can say,
yeah, but
absolutely.
just stop smoking, right?
Stop smoking. Absolutely. Absolutely. Now, the larger picture beyond all these specific dangers of bariatric surgery is, Kemal, is what was the reason we did bariatric surgery? Well, the reason was because we wanted people to be healthy. So we wanted to decrease their risks of diabetes, of high blood pressure, of heart attack, of strokes, right? But smoking leads them way back, immediately back there as well, among other things. So there is really many reasons for why it is critically important for any person who has taken the step of having bariatric surgery to make sure that they stop quitting as well. They stop smoking as well.
No, I mean, every time we go through these sessions, either some stuff kind of like settles better, like we have better understandings, or we learn some new stuff. So, and it's important for us to kind of know these from my point. So when we talk to our patients, sometimes they really don't understand why this is putting them at more risk versus the other people. So thank you, Dr. Irgau. So now let's go to the alcohol use a little bit. So it's a little bit different with alcohol, especially before surgery versus after surgery, right? So if we can actually just take that from before and after standpoint.
Absolutely. So let's make a distinction here, Kemal. So it is important to distinguish from people who are just social drinkers from people who have a dependency from alcohol, right? People who have a dependency from alcohol will not be enrolled in the program unless that issue is totally addressed. That is very important. And when we look at the vast majority of our patients, we're looking at people who drink socially, right? And what is our recommendation? Well, our recommendation is that they slow down, and particularly, the 2-3 weeks before surgery, when we put them on a specific diet, the new direction diet that we use to shrink their liver. At that time, we do not want them to have any alcohol at all. So to begin with, just before surgery, they will be slowing down. After the surgery, we also ask them to really hold off from resuming alcohol intake for about 6 months, right? And the reason for that is multiple, Kemal, right? Now, first of all, when we've done bariatric surgery, we have changed the anatomy of the digestive tract to the extent that the way the body handles alcohol will be very different after bariatric surgery compared to what it was before bariatric surgery, particularly with a procedure like gastric bypass, right? So specifically for Karen in our patient example, it would be critically important for her to understand that the stomach that receives the alcohol from the food pipe is so small that the alcohol will immediately enter the small intestine. Once the alcohol enters the small intestine, it's reabsorbed in the bloodstream very quickly. So a person who's had gastric bypass and they have a couple of sips of alcohol will feel the effects of alcohol almost immediately, which means that a person who drinks alcohol after bariatric surgery, particularly after gastric bypass surgery, will get inebriated. They will get drunk with very little alcohol much more quickly, and they are likely to stay drunk for longer as well. So they really have to understand that, because it has implications. So if before bariatric surgery they had a glass of wine and they were absolutely fine, now after bariatric surgery, if they have a glass of wine, it may act as if they've had 4 glasses of wine, 3-4 glasses of wine as opposed to just one, which means the effects are much stronger, right? And to some extent, this is also true for the gastric sleeve. And the reason for that is before bariatric surgery, the alcohol that enters the stomach is almost held up in the stomach. The stomach acts like a buffer. Mm-hmm. Not very much is absorbed through the stomach, right? So the alcohol stays in the stomach and it's slowly then pushed into the intestine where the absorption occurs. So a person who is drinking will be feeling the effect of the alcohol really after a few drinks, not as quickly. But after they've had the gastric sleeve, the stomach is not a big recipient anymore, right? Before the gastric sleeve, the stomach was like a watermelon. Now it's like a banana. So the alcohol will enter and then go through the little opening in the stomach into the intestine much more quickly. So even after the gastric sleeve, there will be rapid progression of the alcohol from the stomach into the intestine, which is where the main processing of the alcohol occurs. So they will feel the effect of the alcohol much more quickly. So there are real dangers to that, right? If you're driving and if you were able to drive with, one drink in the past without any problem, now that could be a serious issue, not in terms of endangering yourself, your family, and other drivers, but also, if you are stopped by the police, you get ticketed a lot more readily, just because the alcohol will show up much more quickly and then in much higher levels in your blood than before your surgery.
No, but I want to tell you earlier when you start talking about how it's impacting with the diet and the small stomach. I don't know if this happens to you when we do our intermittent diet. If I'm on a 5-day, let's say if I do it Monday through Friday, and if I have a drink after that first 5 days, that one drink has a huge impact right away. It's because
Absolutely.
it's not used to it anymore. So, it doesn't have to be just the stomach itself. It's just like how our body is, how smart it is, that it learns certain things so quickly, and also just adapts to the new situation. So then once it knows that, okay, this guy is not, eating as much all the time, everything is kind of slowing down. So every time you do that more kind of like systematically, but I still do it, and I know you do it as well, but when we do it like 100%.
Oh, absolutely. Yeah. When there is food alongside the alcohol, clearly the absorption of the alcohol will be slowed down by the presence of food. And, you see a lot more people affected by alcohol in cultures where people drink without food, as opposed to cultures where people drink alcohol with the food, essentially, where the effect is going to be much less. So there's no question about that. So let's look at the other problems related to the alcohol after bariatric surgery beyond what we said about the immediate effect. Well, first of all, if you're trying to lose weight and you drink alcohol, you may be defeating that purpose, essentially, because very often alcohol will have calories in itself, and these are calories without any nutritional value, right? So if you're going to spend calories, you might as well spend them on nutritional value food as opposed to empty calories, which is, what alcohol is, particularly if you're drinking.
Most of them have sugars, right? Sugar
right.
in it.
Right, but particularly in mixed drinks, alcohol, will have a lot more calories because those mixed drinks very often are sweet, and they will have their calorie as well. And then the other issue that we also know is that people, when you drink alcohol, your appetite increases as well. So you're less likely to feel fullness, and you're more likely to continue eating as well. So drinking alcohol clearly is not going to be helpful to a person who's trying to lose weight. And then the other, very important factor, Kemal, that is concerning is that, there is alcohol addiction, right? People can become dependent, right? And this could be even for people who never had any alcohol problem before. And why is that? Why is that particularly important after bariatric surgery? Well, the reason, Kemal, is that if one of the reasons people struggled with food before bariatric surgery was because they were eating when they had stress, they were using food as a way to really ease some pressures that they had. Then now that they cannot eat a lot because their stomach is small, it is very easy for them to fall back into drinking as a substitute for that. And that's a real danger as well. So when we talk about really easing up and really being conscious about not drinking too much, we also take this factor into consideration, because it is much more likely for them to become alcoholic after bariatric surgery if they are not careful, particularly if there were issues with borderline, alcohol dependency or before bariatric surgery. In fact, when people ask me, doctor, can I drink alcohol after surgery? I really inquire as to what their habits were before. And if I sense that they struggle, I tell them flat out to absolutely avoid alcohol, because they can fall into that danger as well, right? Now, what are the consequences of that? Well, alcoholism is obviously devastating for the individual, for their family, for for anybody around them, for their health, of course, but it is even more so after bariatric surgery, particularly after gastric bypass, because damage to the liver can occur much more quickly if a person becomes alcoholic after gastric bypass than it would otherwise, and lead to liver failure.
So we want our patients to adopt a new lifestyle in a way that this is a permanent change. And it's not because they are just having the surgery, but just because, as you said, alcohol is not good for anyone. So moderation would be maybe the answer from some people, but moderation is changing from the next. So what's affecting you is different than what may be affecting our patients. So, and since they suffered already a lot in their lives, so easiest and cleanest way to stop any future replacement problems is not to drink. But I think Patrick drinks beer. That's what I know. And beer is one of our no-nos on the alcohol list. So carbonated drinks also is on the no-no list. But again, we don't want to necessarily advise how much or how little they should be drinking, but not drinking would be the ideal situation for our patients. So, and maybe at least until they have everything settled in the maybe first 2 years, they know that now they are able to control this, they are able to adopt properly, and they get used to the new living, new life. Because at the end of the day, what we are giving up doesn't actually benefit us, doesn't actually harm us. In fact, it's benefiting us because all the other benefits that we are going to get, it's huge. So why would I want to jeopardize this for smoking or how much to drink? Because certainty needs to change because we are taking this is a big undertaking and commitment. So making this in the right way and seeing our patients in a healthier way is our goal. So we want to make sure that they actually follow this guidelines. Now that I was doing also some training when we were off in the last 2 weeks. I spent a lot of time with our nurses and others. I used to get some messages in the old days. Well, I say old days, but it's end of 2020, early 2021. So what I realized how much information we are putting out there with these sessions, and it's not just for our patient, but anyone who's in medicine or who's getting into medicine, they can learn a lot by watching what we have. So I'm hoping that more people can take advantage of these sessions, and we'll be back next week with a new topic. And the journey is going to continue with these 3 individuals. And because we have an extremely efficient system in place with care coordination, multi-specialty approach with everyone being in one system, our patients are getting great care and great support. And I know that once we get them to that point of having the surgery, life will be different for them, and we'll start a new journey after that. So, well, thank you for being with us. We'll be back next week at 3 p.m. for another Bariatric Friday. We'll see you soon. Bye-bye.
Have a nice weekend, everyone.